Leadership Series. I'd like to really welcome you to this edition. And today we're going to be looking at the health systems for Nigeria, the health systems for Nigeria. Nigeria is truly a great country, a wonderful country. It is my intention that we continue to speak positively about this, our great and mighty nation, and continue to speak into the nation and pray about the nation and make sure that the nation becomes what it is supposed to become. The African Leadership Group is a group of people who are concerned about leadership, progress, economic development, and direction, not just in Nigeria, but all over Africa. How can we emancipate the people of dark color? How can we get them to think right? How can we get them to fulfill purpose? How can we get them to achieve what they're supposed to achieve? Can we get them to get out of the underserved, underprivileged, and slave mentality that seems to pervade them and makes them not to think? How can we get Africa to become the China of the world, the manufacturing hub, the development hub of the world? How can we get our people to stop thinking only about themselves, especially those who are in places of leadership, and get them to be thinking more about Africa and the common man and unite against a common enemy? And that's also what we're trying to do in the Nigerian Leadership Series, to get Nigerians to think in that manner, and that what is good for Nigeria is the collective good of all and not just the benefit of a few, and to think beyond ourselves. So we are trying to look at every aspect of Nigeria, the history, the background, the policies, the laws, the direction, the economy, and everything that has combined together to make Nigeria what it is. And of course, the critical issue of leadership. How can we get the right kind of leader in Nigeria and position them for the future that Nigeria truly deserves, and get Nigeria to truly become what it's supposed to become? Our guest for today has such a phenomenal CV that I'm just going to ask him to abbreviate and introduce himself as I bring him on the platform today. But however, he's a professor that is currently one of the really outstanding lights at the Lagos State University. And he has been there for several years, written an enormous amount of papers, done an enormous amount of research, both in the medical and in the general fields, and has really distinguished himself in many areas of Nigeria's leadership. A true Christian who almost the Vice Chancellor of University. Please welcome with me today, Professor Olumuyiwa Odusanya. You are most welcome, my brother, and thank you for accepting to speak on the African Leadership Series today. Professor Odusanya, I want to hand over to you right now. I think you all heard what I said. Prof, thank you for being here.
All right. Thank you very much, Pastor Ito Egodalu. It's my pleasure to be here today. It's a very great honor to be a guest on the African Leadership Series and to talk about the health systems of Nigeria. Like you said, my calling is in public health medicine, and I work in LASU, and I've done quite a lot of work about health systems. And a number of our colleagues are here for who I like to welcome. I've seen quite a number, and I'm sure they will have a number of interesting comments to make, because no one has all the wisdom. But thank God for today. It's today He has made. Many people I've seen, just mentioned a few of them. Vice President Jembi, she's one of our distinguished public health physicians. I've seen Dr. Jinodu. I've seen my classmate of many years, Dr. and roommate, Dr. Miware, is an outstanding surgeon. Since several other people in the department, Dr. Kuinu, Dr. Kinka, Dr. Goodman, Professor Kondetu is here. So it's and many more physicians and health workers are joining, but it's a very important thing we have come to discuss. When we talk about, that's my word of introduction, about health systems, many people immediately think about hospitals and buildings and clinics. No. Let's take it from the basics. Health, first and foremost. The WHO has a definition that stood the test of time over 70 years now, since 1948, that health is not the absence of disease or infirmity, but a state of complete physical, mental, and social well-being. That's the focus. It's not just to cure people, but well-being. We're moving from disease, prevention, and well-being. And health itself is a tool for living. Health is not the objective of living. It's a resource for everyday life. Because if you are not healthy, you can't be on this part at this meeting today. You probably be in a hospital or taken to the lab test. All we're able to do to a large extent because we have some measure of quality of health. And health generally, the health systems we're talking about today, is not only determined by actions in the health system itself. We talk about social determinants of health, things like social gradient. We know that people who are in the lower socioeconomic classes tend not to be as healthy. It's not that nature is against them, it's that the resources required to be healthy, such as food, adequate amount of water, clean water, exercise, good nutrition, lack of addiction, whether drugs or alcohol, they are often missing in this lower set of people. I'd like to give us an illustration about that health is not just drugs alone. In the UK, from about 1915, the death rate on tuberculosis and tuberculosis in children declined. 30 years ahead of the discovery of streptomycin, it was the first drug specific for TB use. That was because children were no longer allowed to go into coal mines. That single action alone and improvement in food and milk and housing made a lot of difference. So those are the first things the people in Nigeria and leaders must recognize. It's not necessarily allocating more money to build hospitals, but the generality of improvement in the standards of living, reducing poverty, will lead to improvement in health of the people. And that's a very big call for at all levels of leadership. Then when we talk about a functional health system, we're talking about, I was looking at a dictionary this morning, and it said functional means that it is fit, built for a purpose. It is useful rather than attractive. Most people want to see grandiose buildings, but that does not make them functional. And then when we talk about the health system, we're talking about all the resources, institutions, and organizations whose primary purpose is to improve health. For example, the ambulance driver is a key element and member of the health team. Most people won't recognize him. But if you have an emergency outside the hospital and they need to move you to a hospital, you'll be grateful you have an ambulance that knows what to do. It's as simple as that. And so we're looking at the totality of everything that produces health. That's what the health system is about. And then if a health system must treat people decently, it improves people's health, defends them against threats to health, protects them against financial problems arising from ill health, and there's an economic cost, both direct and indirect cost to health, and then also allows people to participate in the decisions that affect their health. Most health decisions in this country are made by a few politicians, top doctors, top nurses, UN agencies. The people themselves are not part of the health system. And then in terms of a framework, we're looking at 6 distinct frameworks, building blocks, we call them, that define a health system. And these are the 6 that are very key. One is the health workforce or the human resources, the people that work there, be they doctors, nurses, pharmacists, lab people, and there are a lot of problems in that area, a lot of quarrels, arguments, problems that often the interpersonal rivalry overshadows the function they're supposed to do. Second building block is the service itself. I'm talking about service means that the service is efficient, is safe, is effective, is adequate, is continuum. And we're looking at services that cover preventive, promotive, protective, curative, and rehabilitative services. The third building block will be the tools, the medicines, vaccines, and technologies. We're in the middle of the coronavirus pandemic. I was at the Chatham House discussion this afternoon, and they're talking about the G20. There's a meeting next week, and they pledge to make vaccines available. Only the US has been able to donate vaccines. Most African nations are still begging for vaccines. I heard that the African Union is hoping to buy 100 million doses of Moderna. Maybe 15 million will come in December, another 6 million in 2022, maybe the last 15 million in 2023. The pandemic will not wait for the people. So medicines, vaccine technologies, very big issues. Then 4, health financing. The African Union committed to giving 15% of its board of all nations of GDP to health. Nigeria has hardly gone above 7%, maybe really. We are usually doing 3 to 4. Then health information system and obviously leadership and governance. In these 6 areas, these are the things that we need to be able to. Nigeria is good at papers, policies. We have all kinds of things we have done. Midwife services scheme, primary health care under one roof. We have the NCDC now, which is doing a lot of good work. We have the Nigerian Primary Health Care Development Agency, which is fantastic. But in terms of making it affect the common man on the street, if somebody is ill today, what can easily go to a facility and get care? We're talking about universal health coverage as well. And then obviously, doesn't even know what to do. There's a lot of unproven, unorthodox medicines. There are a lot of family medicine shops all over the country. People sell all kinds of things. So the system is very dysfunctional. It's improved, but when you look at the health indices of this nation, we have not done a lot that we should have. We are far below our best as a nation. Maybe let me stop there, use that as opening remarks.
All right. Are you through, Prof? Or should
Yes,
I? Okay. Thank you.
yes.
So, Prof, tell me, what is the state of the Nigeria's healthcare system, and why is it in such a state? Do you have any world-class best practices that you can compare it with? And in your own reckoning, what is the state of the Nigerian healthcare system?
All right. Thank you very much. Health systems can be difficult to compare, but WHO again started and produced a classic report in the year 2000. And each year there is a World Health Report that is published. And people look at it and try and compare. For that was 20 years ago. Nigeria was about 4th from bottom. Even the US is not the best example. The Scandinavian countries tend to do better. When we're looking at the state of Nigeria's system, we look at the health indices first to start with. For example, life expectancy at birth in this is about 64 years. That's low. In the UK, it's more like 76, 77, 80. You look at, for example, immunization rates in children, particularly the pentavalent vaccine 3rd dose. Nigeria doing about 57. In most other places, they're doing, even Ghana, at times reaches about 90-95%. When you look at access to water, we're not doing up to 40%. That's a poor level. In fact, we're still battling with open defecation and access to sanitary excretion, disposal of waste, which is low. When you look at universal health coverage, we're about 43%. In the developed world, we're talking about 80, 90%. That's because of our health insurance is at very low levels, abysmally low levels. So, and then when you consider the physician-doctor ratio again, we are below standard. A doctor in Nigeria is doing about 6,000 people, whereas we're doing about 500 to 1,000 people. So in all the major indicators of the health system, uh, Nigeria is doing not very well for many reasons. Compared to Cuba, Cuba is even Rwanda in Africa is doing better. Ghana is doing a whole lot better. Kenya is doing a whole lot better. South Africa, in spite of all these problems, and Egypt are leading light when it comes to health services to Nigeria. Of course, Africa has a lot of problems with this COVID and HIV, but these are countries that are doing far better than Nigeria. So if you ask me what are the examples, the American system is probably too difficult. It's capital expensive. There's a lot of cost and bureaucracy. So it's not efficient, even though it's high tech. You don't need to be high tech first. It's to make sure the common things that improve health come to people. And then a lot of the things we treat in hospitals are what I call disease of failure of prevention. Why somebody come to our own teaching hospital because he has uncompleted malaria, because he's not sure if he goes to the health center, he will meet a doctor. Although in Lagos, it's improved a lot. Why should we be treating diarrhea at a secondary care facility if people know what to do to simply use oral radiation therapy? So even the amount of level of health literacy is low, and the level of education itself is low. So those are the reasons, those are the problems. Why are we like this? One, and there are challenges both with the people and challenges with the health system. There are challenges outside the health system. Let me start with the challenge of the people. When people, we talk about in public health, a concentric cycle of poverty, ignorance, and disease. They work in synergy. If you are poor, you're likely you are likely to be ignorant about many things, and your risk for disease is far more. Let's take even as simple as advanced as breast cancer. A woman may not know how to examine her breast. You don't have to be a doctor. And then when they have a breast lump, what do? We say it's not my portion. Or she runs from place to place. They put ovary, they put all kinds of things. And when she comes to hospital, she comes in stage 4 breast cancer. Or they say they'll have to do mastectomy, remove the breast, and everybody say no, no, no. By the time they go back and forth, she's inoperable, she can't afford chemotherapy, so she dies. Let's talk about diarrhea, as simple as it is. Diarrhea most of the time is self-limiting. But here comes a woman, a child is ill, he goes to get agbo from somebody or from a neighbor, or somebody give it to her. It's probably contaminated. Is going to, for example, going to make diarrhea worse because even the agbo itself, the herbal mixture is hyperosmolar. It's going to cause more water loss from the intestines. So at that child comes to a health center or general hospital, the child is in shock. That child can go on to have kidney failure. And they will say the child died. And I will say, oh, it's the witches and wizards. When I was doing my housemanship some over 30 years ago at Baptist Hospital, I made an observation, and we found that when children had febrile convulsion, they were convulsing from fever. Their mothers gave them, when they had fever, they gave them one mixture that had cow urine. And what we found was that whatever they gave them had some very powerful action on the blood glucose, that the blood glucose came to 0. That itself, even if they had cerebral malaria, that was going to hypoglycemia that can kill that child's brain. So even in the fact that we have not raised the level of education is a big barrier to health. In many places where the people are not well, and I just have to be Western education, but basic issues about health. Even a lot of our graduates who are active about on social media, who know all the things about TikTok, who know all the things about Instagram, they have low levels of health literacy. They are knowledge about many other things apart from their own bodies and their own health. So that level of ignorance is terrible. Then the social conditions. Many people live in substandard housing, moist houses, where there's a lot of molds, where there's a lot of wet houses. those cells will have upper respiratory tract infection. They will keep coming down with cough and catarrh, and those are things that in the long run will give them pneumonia, and in the many years to come, they could be precursors for lung cancer. There are many people cook in their rooms because they have, and so there's a lot of indoor air pollution. Then access to water. Even when I grew up, and I grew up in Yaba, there was water. There's no more water in all the most taps in Lagos. And once you don't have flowing water, you start rationing water, your level of hygiene will drop. Exposure to fecal disease, cholera, typhoid, roundworms will occur. So the social condition and governance that government should provide that will make people healthy is not there. Food is a big problem. In fact, the last 1.5 years now, we have issues with food security. Many people cannot afford 3 square meals. And once nutrition begins to drop, you see children, they are stunted. That means they are not as tall as they should be, or they are wasted, they are too thin. And those things will affect their brain and future development to become very successful people in life. So personal issues at the individual level, failure of society and governance generally. The budget for next year now is about 13 trillion. But in terms of actual delivery, impact on the people's conditions, and if those things don't improve, then health cannot improve. Then when it comes to the health system itself, it's a bundle of a lot of trouble. Our actions in the health system is to provide facilities, but it's not more facilities. For example, in this country, we're talking about, let's talk about facilities. We used to make a lot of medicines in Nigeria. A number of companies started. Nigerian pharmaceutical industry is now basic trading. That's what they're doing. Bring bulk powder, go and make them and sell. Nobody is doing any amount of R&D because again, the country's climate, economic climate has gone down. So we're not talking about COVID vaccine. Nigeria is a long way from doing any vaccines. I mean, my team did vaccines with a pneumococcal study. All that was meant for Nigeria. We were only doing the clinical trial. But we're talking about getting involved in identifying candidate vaccine, the COVID virus now. How do you isolate it? How do you determine it? We're able to do sequencing, but not more than that. So there are problems around even the health system, inadequate funding, corruption, bribery, absenteeism. Then in terms of, for example, even the response to the health workers, Saudi Arabia came to attract doctors, including senior residents who had not finished training. I mean, between March and July this year, 323 Nigerian doctors were registered to practice in the UK. I'm aware that in the last 1 month, a private practice in Middlesbrough in the UK employed 4 Nigerian nurses into its theater as theater nurses. So we're allowing them emigrate. Residents were in this country for 63 days. We were talking and playing with them, and that's about 40% of the doctor workforce in this country. Those are not signs of a nation that we're praying, we're talking, but we're missing in the things that can make the people's health become better. If we were to do an audit of the number of lives, delays to care, people that have to be discharged from all the teaching hospitals, federal medical centers in those 63 days, it's enormous. The amount of the opportunity cost to family members that have to stop, find ambulance, take them to lower qualified homes. Some will have died, some cases have become worse. So it's like if you look at the priority of our nation, health is very down. And until a nation wakes up to realize that health, that only, like we know from the Amata Declaration of 1978, that health itself, primary care particularly, is an essential element of the socio-economic development of a nation. So we're not asking them to build more hospitals. We're just saying create enabling environment for health and invest in that of the people, and then the people will look after themselves. Thank you.
Okay, you've mentioned a very good point. You said create enabling environment for health. That's what you want government to do. What exactly do you mean by this? And what can government do, or what can Nigerians do to create this enabling environment? Because what I tend to hear people in government say is that we don't have money. The money is not sufficient. There's not enough money. There's not enough money. There's not enough money. Blah, 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 here and there. So what do you mean by what do they need to do? Is there a granulated step-by-step? For instance, if you were Minister of Health of the Federal Republic of Nigeria today, what would you do and how would you ensure that we can transform this sector in Nigeria? Again, the India has suddenly become a mecca of sorts for health. I had reason to go to India about 4 or 5 years ago. To get visa was problem because right from 4 a.m., Nigerians are being carried to Indian embassy, some on wheelchair, some on stretcher, some in ambulances. It's not that they told me, I saw with my own eyes, people besieging that place. And what I was told was that a group of Indian doctors who had trained in America, came together and said they needed to change and transform the healthcare system in India and spoke to government, reached an agreement with government, and they began to invest in the India Healthcare Center. And that has resulted in the upswing of various hospitals of great expertise, the Apollo chain, this chain, that chain, that even very, very great Nigerians have had to go to India to get medical help. Some even died on the way there, on the way back, on the operating table in India. If you go to Dubai, the same thing. There's a big medical village there that Nigerians go both to receive treatment and to work. Saudi Arabia, even Egypt. A lot of my northern friends go to Egypt for healthcare. And the last few days, some of our prominent politicians, including our president, have had to take flights to Europe to fix themselves and make themselves well. And some even making a grand entrance back to Nigeria after they had gone to Europe to look for healthcare. Can you imagine? And they're welcoming them back that they've gone to Europe to fix themselves for a simple operation. And this is Nigeria, 200 million people, can't fly anywhere for any healthcare. What do we do, Prof? How do we sort this matter out? And again, maybe I'm offering you the job of Minister of Health.
All right. I think, like I said at the beginning, health is not about health facilities first. And as long as we are fixed on curative care, we will not develop. We will not solve the problem. And we talk about something in public health, which is my field. We talk about tip of the iceberg. I like us to cast our mind to what sank the Titanic. It ran against what the pilot didn't see how large that iceberg was. So it crashed it. He only saw the tip. Most of the things that come to hospital are but the 1% or less of the problems in the community. So as long as we are focused on that 1%, and even if we create super hospitals, the health of people will not improve. How many people can go to India? Somebody has kidney failure. Yes, he needs dialysis and looking for a donor. And he has 10 million to go to India. He will come back, maybe get another 15 years on the list of his life, or 20. Fantastic. What about several others who can't raise that 10 million? But for who, if they knew what to do, not to go into kidney failure, not to have hypertension, to even treat very simple skin disease, which can, for example, lead to what we call kidney infection, glomerulonephritis, we can then give them kidney failure. If people, for example, get their children vaccinated, which they're doing now, against hepatitis B virus, then the chance of having liver failure and liver cancer is less. So for us in public health, talk about prevention first. And the preventive actions are not first in health. Like I tell people that if I were to handle that sector, I won't ask for health facilities first. I'm going to say, Minister of Education, come. What can we do to make sure that teachers are better paid so that people go to school? For example, if you want to deal with VVF in the north, yes, train all the gynecologists to fix fistulas, but as they fix them, they will come the more. So what do? Get the girls in northern Nigeria to go to school. And they stop marrying at 13, 14, and VVF will drop because they're not having children where they are girls. The problem with VVF is that they do not move, they move from girlhood to motherhood. They do not become women first. So dealing with the supportive environment and advocating on that, and that's a key element of primary health care. Intersectoral collaboration. For example, we're talking about blood transfusion. There are a lot of road accidents in Nigeria. The solution is not more road safety. The solution is not more surgeons. The solution is not more blood transfusion. The solution is make the roads safer. Do driver education. Stop selling ogogoro and brukutu at the motor parks. Get drivers to wear glasses and have proper eye tests. Become more educated about highway code, and your road accidents will come down. Less people will die. Less people will have fractures that you need an orthopedic surgeon to fix. So Nigeria must come back and use primary health care preventive medicine as the cornerstone of its health system. It's there in paper, but we're only focusing and we're doing more of primary medical care as opposed to the totality of concept of health. And that's the first thing everybody must realize. We're not asking for there's a place for quaternary care, build Apollo chair, and there are a number of good hospitals in Nigeria. Since I'm not their marketing managers, I won't mention names, in Abuja, in Lagos, in Port Harcourt, in Kano, they are fantastic hospitals, but they're dealing with the very small people, very small proportion of people. And so when we then begin to find out, for example, we know that one of the key things to preventing birth asphyxia, cerebral palsy, children who have birth challenges and all of that, is to have a skilled person at delivery. Antenatal care is good, but you must be able to have what you call emergency obstetric care, because labor can be erratic. It can go in an undefined time. You must be able to have a place to take that woman to have cesarean section. You must have a place where you can have blood. But I say, if you don't know, or if it happens in a place where there is no transport, or transport is only twice a week, that woman is doomed to death. So again, the first thing I like to say is that we must make preventive medicine, preventive healthcare, the cornerstone. And we're talking about intersectoral collaboration, talking about getting people involved, community participation about the healthcare, health education, promoting their health. Those are the first things, advocacy and raising the level of awareness, simple hygiene, water, food, reducing mosquito bite, exposure to mosquitoes, reducing waste control. If we do those things first, then our health will be ready to fly. Then we can, many of the diseases we're dealing with, and then when people now begin to know about health promotion, exercise, diet, then they will not go into non-communicable diseases, things like cancers, bronchial asthma, hypertension, diabetes, which are all rising in Nigeria. Current data is that about a third of Nigerians are hypertensive. The diabetes controls are about 5%. And if you don't deal with that, hypertension will give you stroke, will give you blindness, will give you heart failure, will give you kidney failure, will lead premature death, will give heart failure. So do we want, how many hospitals do we want to build? I tell people that even if we turn the whole of Lagos into hospital beds, it will never be enough, because we're basically a nation of sick people. And until we begin to deal with the health of the people and getting them to understand the basic things about health, having information which is power, then their health will not improve. So what should government do? Make sure there is water. Get the Minister of Water Resources, make sure there is water. All the states of government, make sure there is water. Potable water, clean water. That solves a lot of problems. Make sure every house has proper sewage disposal. In fact, the issue with polio is because if there was if the child didn't come in contact with polio, thank God for vaccination, polio can be transmitted. Of course, now we're doing many more rounds of polio, and we have fully certified free of the white polio virus. Waste disposal. I mean, Lassa fever is a big issue because of rodent control. So, and then we begin to look at what are priority problems. We're beginning to emerge from communicable diseases to non-communicable diseases, and these are rising. Everybody's on the road working from 12, 16 hours. level of stress, a lot of economic headache, the devaluation of the naira. So people are worried, they're living in fear, their blood pressures are rising, and they can't be healthy. They're sleeping less. Imagine somebody who lives in Otta and comes to work on the island. He gets home at 11, he's up at 4. That's a candidate for a lot of problems in the years down the road. And so, and then when we do that, then we can then begin to make sure that there's access. Primary care people can find health as close as possible to where they live and work. Those are the things. And then we talk about levels of prevention, very key for us to do. And that's what the government must do. First, make the environment, and then we now focus on the health system, training of health workers. For example, now we have people are living. There's a lot of maldistribution between Lagos and Zamfara, and Lagos and Maiduguri or Ibadan and Mambila Plateau. So those are the kind of things. So health workers, incentives, creating enablement, giving them tools to work. And obviously, private sector must come in. We must begin to look at how we can, of course, there are good labs in Lagos, but you cannot replicate Lagos everywhere. There are all the big labs in Lagos for diagnostics. That's good. But what about if a person is in the shine? I need to have a chest x-ray. Must they travel very far to have that done? Thank God for telemedicine now. That's there. And then must be about how do we ensure quality of drugs. The research component is largely not underdeveloped in the nation. And talking about financing, we must raise, the government must commit. Yes, there is primary under one roof, there is PGC and all of that, but the amount of funding that's available, two things take money in the health sector: salaries, two, medicines and drugs take a lot on diagnostics. That must be sufficient, and then accountability, monitoring and evaluation, that people are accountable, and setting up systems that make the people and the health sector itself deliver on its mandates.
Thank you very much, Prof. I'm very grateful for that. I know you're probably not an economist, but I cannot avoid asking this question. You have said clearly that the emphasis should be on prevention, and that is not just even a Ministry of Health or health sector thing alone. Is a collaboration between all the sectors, but then somebody must drive it and bring it to the notice of government or the people responsible, that there are various ways by which we can ensure that we actually, through education and through infrastructure and things, prevent even people getting sick ab initio before we start dealing with those who inevitably get sick and have to have facilities to deal with them. But what is the cost to our national economy of the state of our health facilities? Maybe if people can see in raw numbers what it is costing this economy, what it is costing each Nigerian per capita of this Malay that we have, of people dying prematurely, people being sick and having to lose great manpower in that process, people not having enough to look after themselves. How is it costing or affecting the economy and the average Nigerian?
Thank you. In terms of costs, I don't know about a little about 4 to 10 billion to the Minister of Health at federal level. We have national health accounts, but when you look at the cost of illness, you're going to look at direct costs. For example, if somebody has simple, or what we call uncomplicated malaria, early diagnosis, and is then treated, maybe has a rapid test and gets to get ACT, the combined artemiside, that could cost for about 2,000, 3,000, maybe max 5,000 to that person. But if you then consider that it may be at home for 2 days, if it's quite ill, then he loses his salary for 2 days, depending on his level at work. If we were then to have severe what we call complicated malaria, which could go on to present either he's got cerebral malaria and comes in unconscious, or he has kidney failure because of this cerebral malaria, particularly if he's a young person or a child, then it changes. We are going to start talking about bed space, talk about IV drugs, talk about specialist care. He may need critical care admission. He may need some degree of dialysis in the short term. So what could cost 5,000 could suddenly become 2 to 300,000 naira. Very simple, because it will miss the gap and the appropriate action to take, or they came too late. So when we talk about costs, it is very, very. What we spend per capita in this country per person on health is about between $200 to $300, whereas in other places, we're talking about $4,000. So we're doing about 1/10 of what should be the ideal cost to spend on a person on health as a nation. And the cost of that, we talk about disability, life years lost. The cost will be cost of premature death, cost of unproductivity, and per person is a very huge cost that you, depending on the condition, the cost to the country, economic cost by individual who dies prematurely can be as much as 10 to 20 million of productive work and life lost. That's what I'll put the cost into. So it's huge that we're just developing people and they're not able to contribute their best to the nation because of premature death and illness. And like if they had any of those major problems that I've mentioned, kidney failure that needs a transplant, I'm talking about 10 to 20 million to come back to life. I'm talking about the repeated cost of dialysis, which can be as much as about 100 to 20,000 naira per week. So the costs are huge. The other thing that's important is the issue of health insurance, which we're beginning to make some progress, because about 70% of all financing, if I had to ask people on this, why never don't have health insurance that's functional, maybe 10%. I'm sick, I go and buy medicine. I'm sick, I go and see the doctor, I pay consultation fee, I buy a card. And when it's more than what I can pay, or if I'm supposed to transfer money for admission and there's no problem, they don't have the money, then there's a problem. So that the costs are huge per person and per condition. And it could be as much as 10, 20 million per person, depending on the condition. But on the average, I don't think for any average simple problem, they were not losing at least less than about 2 to 500,000 naira in Nigeria.
So do we have any hope in Nigeria? Is there any possibility that our healthcare can improve? And is there any possibility that we can again become a model of good healthcare in Nigeria? And then when we talk about health infrastructure, like it used to be in the 60s, where people used to come to Nigeria even to receive healthcare, can we take it to that level again? And is there a roadmap that we can go through to get there, Prof?
Yes, there is hope. There is hope, great hope. And a lot of roadmaps have been drawn. I was going to mention what President Yaradua was trying to do is 7 critical areas. And your good friend and classmate, the former Emir of Kano, mentioned that 7 was too large. He should do 1 or 2. And if he does 1 or 2, the next person will do. And the problem is that maybe because the mountain is so large, we try and deal with everything at the same time. First again is, let us go back to what our health policy states, deal with primary health care. And then because that takes care, most health problems can be looked about at primary and secondary care. Maybe primary can talk about 50% of what problems, secondary care about another 30%. So I leave the 90 or 20% to tertiary care. Once you have that being done, then more funds are free to build the super hospitals and put in the CT scan machines, the super whole body imaging, the laser therapies and all of that. It's fantastic. It makes professors and super specialists, it makes them tick. Well, they all know that they're treating but a small number. So that roadmap, talk about health sector, we must go back, for example, energize the NPHDA, the Primary Care Development Agency, put a lot of investment into the Center for Disease, which is doing quite a lot of work. Make sure the World Health System works. For example, we have a lot of databases now, so it should be possible to actually know in each community, number of people living there, because you must have numbers to plan for. How many people will come to this health center? How much do they need to provide health care for them? Now we have state primary health board, let them budget, costed plans, and say, okay, we expect to have 20,000 cases of malaria in our local government. So do you have enough drugs for 1 year? Then we're on top of it. Then we know, okay, in this population, we expect to have maybe in Nigeria, 50,000 cases of breast cancer per year. What are we doing about it? We expect we need 30,000 dialysis machines in the country. We begin to plan. And then we get investments, long-term concessionary loans to put up those structures. But the primary things we must do for ourselves and make sure that we're able to involve the people in their health, providing health for those at risk under 5, mothers and infants.
Thank you very much, Prof. We're going to open the floor just now for questions and comments. I see that we have quite a lot of eminent people in the healthcare industry in Nigeria, so they may wish to make their own comments or ask their own questions or make their own inferences. If we can walk away from this platform today with a bit of an idea of a roadmap, or at least the fundamentals to help Nigeria build a strong and viable healthcare sector, I think we would have done quite a bit. And I really want to thank Professor Odusanya for his great contributions this afternoon. Prof, I want to ask you maybe one more question at this point in time. And the question is simple, and you may have even alluded to it along the line as you spoke, but I want it to be very precise, very poignant, and straight into the faces of the people, and for us to know, why has Nigeria and why have successive governments in Nigeria failed or not done enough to take up health as a critical issue and make the right kind of policies, practices, and investment in this sector to make it numero uno, if not in Africa, but all over the world. You know, I tell a lot of people that in the 60s, at least in the 60s, Nigeria was a leading health center, especially for tropical disease in the world. And UCH, I'm told, was the 8th best hospital in the Commonwealth. I was born in a hospital called the Jericho Nursing Home, which was established around 1920 or 1930 something, largely for expatriate families and their children to receive what was then considered to be first-class health care. I went to visit the place about 2-3 years ago in Ibadan, and I recognized the place straight away. It was like a deja vu, and a whole lot of memory came flooding back into my head as I drove up the center. But when I went in, it was clear to me that since 1953 or 1954, not one investment or renovation had been made in that place. In fact, the medical director confirmed it, that he is not aware in his own tenure of any kind of investment made in that place. The place was just as it was, as I remembered it as a young child in the 60s. In fact, worse, because by this time the floorboards had fallen, some parts of the roof had caved in, 1 or 2 of the wards had been shut off because they were not fit for human interaction. You couldn't walk safely in that place. And just 1 or 2 beds here and there, the whole place scanty, and it was just very, very sad state. Why have successive governments, both national and subnational, not paid the right kind of attention to this thing called health?
I think somehow the leadership over the years has not put enough priority on the lives of Nigerians. I'm sorry to say. I was looking at a paper 2 weeks ago, and this was a paper written by people who are not even doctors, and they just blamed the entire political leadership since 1960 of paying lip service to the health sector. Case in point, a head of state, before he became head of state, who had participated in leading two coups, mentioned that our clinics hospitals have become mere consulting clinics. What did he do when he didn't have power? He didn't do anything. Even the present administration, people have talked about not having medicines, even in the seat of power in the clinics, and yet budgets are quick. So I think it's a mix of inefficiency, of corruption, of lack of accountability, and of the people of the nation are largely poor and powerless. For example, we have about 140 people on this call. The man in my village who is at his cassava farm cannot come on this call. He's busy fighting for survival. And so he's not bothered who is ruling him. On the day of election, they'll give him money. He will go and vote or may not go. So the commitment, it will appear in Africa, the poorer the people, the stronger the political class. So I think that's the strategy, and that has probably not helped us. And so, but what we can do as a people is to then raise these issues. If most of the people where I've seen a lot of professors, when I'm going to ask to make a few comments before others do, if we occupy the space and give our best everywhere we are, then the government can be then held accountable. Again, even if the funds are not enough, how is it health facility utilizing its funds? Are they publishing? We talk about Freedom of Information Act now in terms of accountability. This is how much was budgeted for hospital X and Y. What did they do with it? How many people did they see? How much did it generate? What are the problems? In almost every budget, we buy the same things. We buy computers every year. We buy autoclave machine. We buy this. So there's a lot of leakage as well and accountability. But is that generally there's a disconnect between the leadership and the governed. And that just scatters everything. And that's why health has become, we've had a few innovations and a lot of the changes have come from donor agencies. Largely, we get on the bandwagon of global programs. USAID gives us money, WHO brings money, that brings money, fine. But the people themselves, leaders and ourselves, must begin to demand, which is in the Constitution, so as a fundamental right of the government. But in Nigeria, we say these are not justiciable. I cannot challenge the government for not providing me a service. The court will say I don't have time. I have no local standard. So we must change that and hold people accountable, and then we can make progress. Maybe as we are opening the floor, I would like to maybe ask in this other field of our people to make comments because they are very eminent people. There is Dr. Vincent Ahonka, is from the US. He's worked for a big pharma company and including the Bill and Melinda Gates Foundation. He's my good friend. We've had a lot of work together running health service in rural Nigeria. It's about where he comes from. So I'd like him to make a few comments. Professor Suzu is the national president of a Society of Public Health Professionals. I will make a brief comment. And I also like Professor Clara Ejembi, who is from maybe Zaria and is a very major player in particularly supporting the MPGSA. Professor Kondetu is a health system management expert. And then one more person, Professor Rotimi Akinola, who has recently led the Society of Obstetrics and Gynecology in Nigeria. Maybe if I have those 5 people make comments about health systems, then we will have very great expert opinion and roadmap that can help us as we on this platform. So maybe if Vincent is there, he could please speak. Then after Professor Suzu, then Professor Kiola, then Professor Jembi and Professor Kwande, and then we can, these are people I've recognized on the platform that I think that other people can then make all their comments. Thank you, sir. So Vincent, I'd like you to please talk.
Can they please signify by the raise of their virtual hand so that I can give them access to...
All right. Vincent Ahonka is there, AHON. Please maybe raise your hand electronically. Dr. Ahonka, Professor Suzu, Professor Ejembi, Professor Kode, and Professor Kiola. If you please raise your hands. There are a few other people who probably or who may want to talk, but those are people I've identified that I would like to make a few comments.
Professor Suzu can please unmute now.
Yes, okay, Professor Suzu.
I just want to thank all of you for giving us the opportunity to listen to what you have just said, which is very rich. I'm not sure I can say anything that anybody in Nigeria will listen to and do what needs to be done. So I don't know whether I should say anything. I posted something on the chat box. When we had the original republic, the states were able to do things. Our was able to make education free, and the health services were literally at everybody's feet. But now, if what we have are units for corruption, not federating units, units that are incapable of the 4 functions of federation units of health, education, public works, and security, social and physical, then there's nothing we're going to be talking about education, about health, about public works, even road to go where you want to go, or water supply. Those can't work. Those are functions of federating units. And if they're all in the hands of federal government, or they can interfere with it anyhow they like. So how are you going to have those things? So when people are talking about restructuring, people think there's any other thing. Every single thing in Nigeria, that's the basic way they can all function. We must return to federating units that are able to perform these basic functions. They are not functions of federal government. Education, basic health service, including supervising local governments to provide primary health care. They can't be supervised from Abuja or from federal government. So those are more fundamental issues. The further away governance is from you, you can't do anything about it. And these fundamental things it takes to be human beings, to have services of human existence will be impossible. So I don't know how anybody can be talking about it. For me and my household, we just do the little we can do in where we live or work, and leave the rest to God. Thank you very much. I hope I've said enough.
Yes, sir.
Thank you, Prof. Asuzu. Thank you very, very much. That's very insightful. Who next, Prof?
Professor Oluwarotimi Akinla can make some comments if he would like to. He's led the body of doctors that provide obstetrics and gynecology service in Nigeria, Stogon. I'm sure he has a lot of rich experience to mention. I've asked him to please raise his hand and make some comments.
Thank you very much, Professor Odusanya. This is actually a catch-22 situation. I remember that I met a Nigerian in Canada who had left the shores of Nigeria to go for treatment. And when they wheeled this person into the theater, he met a Nigerian surgeon. The anesthetist was a Nigerian, the nurses. So actually, it was like transporting Nigeria into Canada so that they can treat after all the expenses and all that of getting there. And of course, that person had a rethink about what is the problem with us. We say, for example, in obstetrics, that there is a maternal road to death. You have actually dealt with some of those things before. The truth actually is that we are in a situation where we are born, we are fed, we are given just enough to keep the last breath in our body, and then we die. Because it does not look, just like the last speaker said, the system is faulty. Primary health care as different from the system where healthcare, primary care is given. The difference between primary health care and primary care is not being exploited. So we are rendering primary care in the tertiary centers, and that is a problem. Now, when you say, for example, that basic education, we had experience in the past where, but from studies that were done in the 80s, you found out that even in Zaria, those who had basic education had the least likelihood of dying from pregnancy-related causes than, and this is not in, is in multiple, and those who, I mean, you find out that the multiplier effect of not being educated is so much. So now think of the fact that people are being gotten out of school. People, there are more out of school children. Insecurity is major there and all that. And then look at all the people that are being cared for in internally displaced camps. So the problem of Nigeria really cannot just be taken in isolation. Health is just that minute part of this. You find out, for example, that even when you talk about what is the percentage in Nigeria currently of we have the highest out-of-pocket expense. How many Nigerians are recruited into the health insurance that we've been bandying about for all these years? So you find out that the problems are principally those of people have to really sit down and make a commitment that we can make this system work. And I'm sure it will work because we have the hands, we have the capacity. What we need is a commitment. And some people will say it's just the political will to improve the health of the people. Every day people die in Nigeria and it does not make news. You find out, for example, that it's getting to be such that it doesn't even matter. 40 people killed, 10 people kidnapped and all that is already no longer news. And I'm sorry, that is the way we're going. Thank you very much.
Dr. Honkai, next. Vincent, please unmute and speak. Your hand is up.
Thank you very much.
Okay.
Can you hear me?
Yes, we can.
Thank you very much, ladies and gentlemen. First of all, the organizer, I think you've done a wonderful job of approaching this problem, and my good friend, Professor Odusanya, has examined most of the aspects. I am talking to you as a village boy from Sabongida in Edo State, even though I'm talking to you right now from outside Philadelphia in the United States. I'm as completely linked up with my village, with other villages in Africa and the low and middle income countries as I am with high income countries. The problem that we are talking about is multifarious, and the problem we're going to be attending to is how do we tackle all of these? And I think we should recognize it is not possible to handle the multiplicity of issues that Professor Odusanya has referred to. What should we do? We should prioritize and we should focus. And if you go with what Professor has outlined, let's talk about primary health care. Primary health care, if attended to in a proactively strategized and implemented manner, will result in a lot of progress. Not in 1 year, not in 5 years, maybe 10 years. But you start by defining the scope of the problem. How large is it now? What is our under 5 mortality rate? What is our goal over the next 5 years? and 10 years? Where is the budget to attend to the things that we need to do? Professor Odusanya and myself and others have implemented this on a rural level, where you fixate and no deviation. You are focusing on one thing only. That's the only way you can measure the impact of what you're doing and tackle other things after you've had some results in the area of focus. So primary health care that talks about childhood immunizations, that every baby should be immunized, and a primary health care center that is available to attend to minor ailments, not minor to the parents and the children, nor the individual adults, and pregnancy and birth management at the rural level and at a level that is accessible in the cities. The Minister of Health years ago was able to start those healthcare agencies across the country. And I think those can be, I mean, Professor Ransom Kuti, I'm sorry, I wasn't specific enough. He was quite successful in his administration in attending to primary health care. Focus on primary health care and focus on measuring what you're starting with and measuring your progress is my suggestion. And of course, how much budget is being assigned at the national level to health. I want to stop there because there are very many areas to consider, but we have to take it one step at a time. Thank you very much.
Thank you, sir. Will Professor Ejembi please like to make some comments? Professor Clara Ejembi. Please unmute and speak, ma'am.
Professor Ejembi's hand is not up, but Professor Faduyile's hand is up.
You can also speak, then Professor Konde, and then Dr. Leke Piton, who has been former commissioner in health, is also on this call. He can also, at least he's been in government, we can tell us what the few things was able to do in terms of health sector reform and all that. So let's take Professor Faduyile's hand is up. Professor Konde, please raise your hand. Professor Ejembi, please raise your hand, and then Professor Dr. Leke Piton, please raise your hand, sir. Thank you. So let's have Professor Faduile then.
Very much, Professor Odusanya. Thank you, the organizers. I think we have had a very great lecture. The only addition I want to add is what the organizer has asked. That is about how do we go about getting these reforms and getting things done in the health system. My own view has been that we need to talk to our leaders, especially our politicians. What we have had over the years is that the politicians are mostly interested in wild elephant projects, opening up of big edifices, opening up of big institutions called hospitals, even ordinary equipment are not put in place. And to maintain those old buildings or old institutions that have been in place, it has been a big problem. If we can only focus on ensuring that the primary healthcare centers are working effectively, if we can let the politician know that it is not by the number of hospitals or institutions that are being built or commissioned, that is what they will use to assess them. If they can get those primary healthcare centers and those institutions that have been in place working effectively, I believe it will have a lot to do in improving the health statistics of Nigerians. And it is important for us to enforce, or not to enforce, to let the government ensure that they stop all the wasteful expenses on very high, those high equipments that are servicing very, very few number of people. We need to work more on the primary care centers. Thank you. That is my own contribution.
All right, thank you. Can we have Professor Akonde? His hand is up. And okay, Dr. Quiton, fantastic. Let's have Dr. Quiton, sir. Former Commissioner for Health and Education in Lagos State. Thank you, sir.
Well, good morning. Thank you very much, Professor Odusanya and Pastor Itua and the organizers. Thank you very much. I'll quickly just make a few points because time is far gone. Well, you talked about health sector reform and what can be done. You also mentioned that during the time we were in government, what did we do? Of course, you know, we did a health sector reform, tried to put the health system in Lagos State on to an organized system with clear-cut structures, governance, financing, and all that, we did a lot of things. We made it into a law, and it even involved blood transfusion, many things you have mentioned here. But moving forward, because that's really the key issue here, moving forward is that improving the health system by government is not really a difficult thing. It starts first by making sure that health is a bankable sector. What I mean by bankable means that government has to find a way of ensuring that health care is properly funded in terms of health insurance, making it spread, truly putting in place universal health coverage. We have continued to be at 5%, 3 to 5% coverage for many, many years since health insurance was started in Nigeria. That has to be focused on. And part of the ways is that government has to, first of all, be ready to take responsibility for the poor in terms of paying premium on behalf of those who are poor. We've written a package recently when this government was about to come in 2015. The paper is still there with the vice president, and all that needs to be done is there with him. And part of it is what I'm saying, including taking taxes from tobacco or what we call sin tax and so many other things to put together for government to pay for those who are poor in terms of premium. I'm talking of premium for health insurance. And then making sure that others are also made to compulsorily pay premium for their health insurance. That is, you make insurance compulsory, health insurance compulsory. That must be started, and protect the poor by way of government paying for that. Once that becomes in, you'll find that private sector will come in being part of the supply side. Access will become easier. The burden will be less on government. All these issues you mentioned, that government should not be seeing things from point of view of making white elephant projects and so on. These are things that will naturally fade away. Government itself will look at its primary care centers not just from point of view of government being the sole provider of primary care. Government sometimes wants to see using its physical primary care center structures, but appreciating the fact that health system consists of both the private and public. They are all part of the same, they are all in the same one basket. What I mean by this is that places where there are no private sector facilities that can provide primary health care center, like in fact, difficult to access areas and so on. Government structures, government will make sure the structures are functional there. Many ways, making sure that the locals there are encouraged and assisted to be healthcare workers at those lower levels. Not necessarily that they all have to become doctors and super nurses. No, ordinary extension, ordinary CHUs, which are community health extension workers, and the senior, immediate senior level, and CHOs can be put in those places, and people encouraged to go there. While in the urban and semi-urban areas where there are private facilities, they can be brought on board as primary caregivers. And because health has been made bankable, those private sector people will find their facilities become useful rather than redundant through health insurance. That way, government will not need to start reinventing the wheel where there are. So another thing is that there are so many structures, facilities that are abandoned in Nigeria that government could use, and with PPP turn into even secondary or even tertiary specialist facilities. There are many. I don't want to bore you with that. Former secretariats, so many buildings, both in Lagos, both in other states. Government wastes a lot of money going to build federal government secretariats in various states when there are no facilities for people to go to attend, and so on and so forth. So being bankable also means that private facility, private practitioners can approach banks. And since the banks know that this practitioner facility is on health insurance system, people are coming, they are paying, they will advance in capital to further improve his primary care center. And if it's secondary, yes, they will do so, and work out arrangements to ensure that the money is paid back through the capitation and fee for service he gets from health insurance. Furthermore, as a matter of policy, government should also ensure at Federal Ministry of Health level that original equipment manufacturers are brought in and made to sit down and compelled that if they want to continue having business in Nigeria, they should ensure that those equipments, CT scan, MRI, ordinary digital X-rays, and simpler things, mammography machines, and other things that can help even in doing primary care monitoring or screening, are made available in a manner that are affordable to the practitioners. Well, what I mean is this. What is going on now is that such original equipment manufacturers or OEM make it appear as if they just want to dump equipment on those practitioners, and the amount of money they demand for maintenance, the amount of money they demand for even procurement, they are usually out of this. Because what that does, and I'm raising that because people may not look at it, is that it completely takes healthcare beyond the reach of the general masses. Considering the fact that people's purchasing power is low, I pity those who are setting up high-tech facilities in Nigeria, because the percentage of those who can afford it is very low, And some of those who can afford it sometimes will prefer to go out of the country anyway. The majority that are left behind who can't afford to go out also cannot afford to pay for the facilities in those high-tech structures that are coming in. And it's all because health has not been made bankable enough. And it's because also the original equipment manufacturers have been allowed to just run into the market on their own and provide facilities on their own terms. They are on their own terms that are only positive for them rather than positive for the health sector of the country itself. I will stop now because I know there are others who want to say a lot of things. I'm just trying to point out some bullet points and so on.
Thank you, sir.
Thank you very much. Yes.
Okay. Maybe Professor Konde, very brief comments, and then Professor Jembi.
Yeah, thank you very much, Professor Odusanya, for this brilliant presentation and for all the contributions made so far. I'll try not to deliver another lecture, so I resist the temptation. So what I'll just say is a general thing, that all that we have identified today are already known. Solutions to them are already known. They are in various sector reforms, policies, and guidelines in place. Our challenge as a nation is how to implement it. Who is to implement it? Human beings. Some people get there, they don't know what to implement. They don't know what to do. Some get there, they know what to do, but the environment will not allow them to do it. They are bogged down with some viruses. I don't know the name of the viruses. Mm-hmm. At the end of the day, we'll remain where we are, and we'll continue to speak over and over the same issues. But let me remind us that the health sector in itself, or the health system in itself, cannot be isolated from the general system in Nigeria. Until we have a pan-systemic way of getting all things done, we will not move. I want to thank you again for giving me the privilege to say this. Thank you.
Thank you. Professor Jembima. Your hand is up. We would like you to make comments. Please unmute, Professor Jembi.
Okay, thank you very much. I want to congratulate the organizers and Professor Odusanya for reminding us yet again for all the things that we know over the years, and we have not been able to move beyond knowing that there are problems. I think for me, the fundamental problem is a crisis of governance. The root cause of all these problems is poor governance. Until we sort out governance issues, I don't think we can begin to get out of the woods. If we don't have leadership with that, at least that is responsive, we can talk from here to eternity. Nothing is going to happen. So fix the governance, ensure that they have the political will. I remember some years about at the dawn of the new democracy, the government of the day then said they were prioritizing primary health care as one of the pillars of their anti-poverty measures. And we were to do a national situation analysis to inform the retooling of PHC. We had developed survey tools, everything. We were in the field. We had not even started data collection when they sent contractors to come and start looking for where to site the clinics. You know, and we were wondering, what is that? At the end of the day, we found so many buildings. It wasn't about infrastructure, but they were empty, no drugs, no workers, but they had given out contract and spent the money because they wanted to see visible dividends of democracy. So till we fix the governance issue, honestly, all these things we're talking, we're just talking shop. Secondly, you've mentioned all the social determinants of health. Till we begin to ensure that health is mainstreamed in all policies. I mean, if they just invest in female education, you'll deal with maternal mortality, we'll deal a lot with child mortality, you know, and these are major issues in this country. We cannot talk about primary health care when people are so poor they cannot meet their basic needs. They don't have food, they don't have anything. So if they don't have, they can't meet basic needs, how can we be talking about PHC? Because health is within the context of human capital development. It's not just about providing clinics and all of that. And they all know that. I think they talk about it, but how do we foster it and get it to move? And of course, we cannot be talking about PHC. Most of the time we talk about PHC is building more facilities, getting more drugs, vaccines, and all of that. The basic principles of PHC, how do you foster community participation in such a way that you empower people, to take greater control of their health, to know what to do to promote their health, to prevent disease, to manage their health problems, and all of that. We have not, invested in that. Equity issues are a bit low on our agenda. And all sorts of other principles that we talk about in PHC, it's not being applied. Each time we're talking about is getting facilities, getting people. And of course, the financing of health is also a major issue. Our health insurance does not seem to be working at all. 2017, the national health accounts, the coverage with health insurance in the country was actually 1.6, not 5%. And they've been on this scene for, is it 40, 50 years? How many years? And without, financial risk protection, really strengthening our PHC, we cannot be talking of universal health coverage. And without investing in community components, of PHC and all of that, forget it. So I think we should go back. The root cause of our problem is governance. Fix your governance, and I think we can begin to get out of the woods. Thank you.
Thank you very much. All right, Pastor.
Thank you.
All right.
Thank you very much. Is there anybody else with any comment? I think the comments have been very, 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 very useful. And I like this assemblage of very knowledgeable people. It's almost as though Professor Odusanya has put together a Nigerian health committee or something or the other, probably almost deliberately, to try and speak to this issue. But somebody said most of these things, we have said them again and again and again. And I like the lady who spoke last and said, fix governance. So I'm going to throw that question back at her and possibly at Professor Odusanya and whoever else chooses to comment as we begin to close as our final comments. How do we fix governance in Nigeria? How do those of us, very well qualified, eminent, educated, exposed people on this platform ensure that we have the right kind of people in the various governments in Nigeria? We're all sitting here, knowledgeable people. Some of us have escaped to the diaspora here and there. And everybody is waiting for governance to fix itself. And we're not actively trying to fix this governance. How do we do it? What are the steps that we need to take on this platform among these eminent people? One or two of whom have even been in government themselves. What are we going to do? Are we going to sit back and continually look at people who don't have the exposure, knowledge, competence, experience, or interest, compassion, or passion, continue to direct the affairs of this truly great nation? What do we do, to fix this governance? And we have about 14 months to do it. Professor Odusanya, what do we do to fix this governance?
I believe that governance is not central. There is a central government, but everybody pretends that everything has to come from Abuja. I think number one, let the health sector people be exemplary, be committed to their work. Let's also, as a people, get involved in the governance where we live. Community development associations influence a few people change orientation. I have voted in every election since 1983, deliberately, because if I do not vote, I have no right to complain. Many will not vote. Many see it as a day to watch TV and do many other things. If you have the energy and power, join a political party and influence it. We cannot keep, nature abhors a vacuum. We cannot keep talking and we allow people, other people to lead Nigeria. It will be tough. But until we hold leadership meetings like this and then cascade our ideas through our churches, through our town unions, because the people who get into central governments, whether a local government, state, they are not devils or angels. They are people from our villages. We see how they steal money in all those associations as well, and we are comfortable with them. So when they then get to the bigger stage, they do worse. There's for us to, in every sector, we're not looking for saints yet. We're looking for people who will have some fear of God, some commitment to help the common man. Chief Oluwa said that if you do not train the child of the poor, he will not let you have peace. That's what we are beginning to see in Nigeria today. So if each of us, 143, almost 150 people, make a difference, get to work early, be passionate, influence through our various town unions, our churches, our mosques, and we begin to make a difference little by little, then we can make a lot of difference and be involved in politics. Register for elections, get a PVC card. Don't say it's all ruined. No, go and vote, discuss, move things around, and let's keep asking questions. Let's keep dictating. At least we're all educated, we can influence the media. We can set up blogs. In fact, I want to suggest Pastor Itua that set up a website and keep publishing ideas about leadership. Someone will read it and will change. Set up a blog and maybe people can contribute to it. You see, once you have a critical movement, even the wicked will be afraid. I like to stop.
I like that, and I like to take that as your closing remark.
Yes, sir.
Once you have a movement, even the wicked will be afraid. And I think the summary of what Professor Odusanya is saying is that every single one of us, the 148 of us here at the highest number, should simply get involved. Get involved one way or the other on your street, in your office, in your church, in your mosque, in your place of influence. Carry your voter's card. Begin to analyze and decide who you want to rule or govern Nigeria at various levels. And also begin to decide who you do not want. And make up your mind that these ones, if they try to come, you will talk against them and tell them why they're not fit for purpose. And not just wait and allow yourselves and your future to be taken out of your hands and you are just on the firing line. People must begin to speak up in Nigeria. We must not allow government or anybody to prevent us from saying what we want. We're free citizens and we must fight for that freedom. It's as simple as that. People are afraid to speak up because government seems so powerful, but government is run by people like yourselves and we must be ready to challenge them. Where they're doing right, we say, yes, you've done right. Where they have not done right, regardless of who they are, we tell them that they have not done right. And we must not allow them to stop us from saying what is right from wrong. Above all, we must train our children and let our children know right from wrong. Professor Odusanya, thank you very much for your friendship, for your love, for finding time to be here, for elucidating in such simple and clear terms a way forward for our health sector. I'm going to be asking you to take this gospel back and preach it in your own area of influence. I also might be asking you to one day assemble for us your colleagues who you have put together to let us really look at this thing a little bit deeper and have a health sector reform roadmap, or even pick up all the various reforms and channel them into one roadmap that even if we're not in government, we can give to somebody who is in government and say, please do this. I think Dr. Piton said they did give something to the office of to the vice president. I do hope that it will be used at one stage or the other, or if not, I don't know. It's there. Nobody's been able to say whether it's been used or not, or maybe they didn't find it useful. I don't know. But we intend to keep at this thing and make Nigeria great again. Nigeria is a great country, and it will be great again. Professor Odusanya, thank you very much. You will be hearing from us. I want to thank everyone on the platform, especially those who made contributions from all over the place. It's been a very, very interesting and exciting evening for me, and I have learned quite a lot. Maybe by this time next week, I myself will be a professor of medicine. God bless you all. Thank you.
Bye.
Bye-bye.
Bye. Thank you.
You, Prof.
Yes, sir.
Thank you so much for today. God bless you.
We're very grateful.